My wife accuses me all the time of being too passionate about too many things. I've been involved in the equestrian world and training horses, and my extended family owns a ranch. I've taken up road biking with my sons, and we're involved in a race this fall, and I've spent a lot of time training. I was in my bike shorts, had my bike in the car, and headed over to Huntsville to meet my friends to go on our regular Thursday bike ride. And I was having a lot of having a lot of irregular heart activity. And my good friend, Jim Haley, who was bike riding partner, he said, if I were you, Steve, I'd just drive over to the fire station and see if those guys would take your blood pressure and maybe take a look at you. The rest is kind of history. I took a trip to the hospital in an ambulance. Dr. Dan's a wonderful man, and he and I have a lot in common because he too is a road bike rider, has competed in a lot of big-time races and has a lot of knowledge about biking. We chatted a bit about medication, possibly going on some medication, which I'm very opposed to long-term medication because of the side effects involved. So I asked him what else was available, and he offered me the option of having an ablation. And I was very interested.
Ablations are done in numerous organs for a lot of types of problems, but in cardiology, and in particular in arrhythmias, in cardiac electrophysiology, ablations means that you will eliminate some tissue that is electrically abnormal. And in this case, for atrial fibrillation itself, you're eliminating cardiac tissue from the atrium that is not involved in the mechanics of the chamber.
He indicated that he would put some liquid nitrogen in a balloon and use that to do the ablation.
So the tissue gets frozen and it creates what we call a deep burn freeze. And that destroys the tissue that is abnormal and hopefully eliminates the trigger for this arrhythmia. So it's a much gentler way of ablation, and the patient would feel that. In other words, the healing process is much faster, they don't have pain.
And I was very obedient to those restrictions, but after that lifted, I started biking, and our road biking crew was pretty intense, and my heart responded marvelously, just flawlessly, if you will. And 3 or 4 days into my bike training, I felt very strong. I seem to have done very, very well. And I'm very, very appreciative to anyone and all who made that happen. And I feel like Ogden is in for a real treat, and they're in very good hands with this technology at the hand of Dr. Dan.
I would like to thank all the donors for their thought in making this real and making this happen. I think that I would like to thank them from all our patients, all my patients that I'm seeing with atrial fibrillation, because otherwise they will not be treated in the best way that there is available right now. And to thank them from my standpoint, because I'm reaching an age when I know that I will develop atrial fibrillation and I would like to have a cryoballoon myself.
I'm very pleased with my ablation. I think I did the right thing.